Is Tamara Smith now joining us to talk about the ambulance. You put this up on a post. Good morning, Tamara Smith. How are you?
Good morning, Julianne. How are you?
Good, good. Now, you put out a Facebook post out yesterday to say there is no ambulance cover for 200 kilometres east, as we said. So that was such a vast area, and 120 kilometres from Byron. So at Leysmore Base Hospital right now, there are 11 ambulances stuck ramping, waiting for their patients to be seen in the ED. And there are 3 police vehicles waiting as well. So what is the problem?
Well, that was 6 o'clock last night. And look, the paramedics tell me that this is not unusual. And I guess, there's a whole lot of reasons. But, not least of all, that the staffing system that they have, which is called PAR, which of course the paramedics would be much more well equipped to explain. But my understanding is that it's outdated and it's not suiting regional areas with vast differences. The ramp time and our EDs is a big issue across the state. And I know that the Minister is making inroads with that, trying to triage and offer, support for people without them having to go to the ED, because we know that once people go there, if they haven't got a life-threatening medical condition, then they can wait there for, I get constituents wait there for 10 hours sometimes. So I know that the Minister's well aware of all of the issues, but for regional areas, I think it's completely unacceptable that for however long, while those AMBOs were, and they're doing the best they can, are waiting with the ramp time at hospitals like Lismore Base and John Flynn, it means there's no coverage for people if they have a critical incident.
So obviously, it's, as you said, it's not the ambulance fault, the paramedics. Surely what's the other end with our hospital system, that they have enough staff to take these patients in ED? Is ED swamped because of this being such winter time and there's so many dreadful flus going around?
It is. I mean, staffing, without going too down the weeds, the surge model for nursing is failing us as well. We would rather see above establishment, full-time nurses and above establishment paramedics, because what I'm told is on their rosters, it just doesn't, I would describe it as a skeleton. It's skeleton rostering. There's no, because the health system across the board is so expensive, and we're very lucky. We do have an incredible, and I don't want to be talking down our health system. Our health system is amazing. It's one of the best in the world. But for regional people, we deserve better than to be without coverage. So to me, the Minister needs to bite the bullet and actually over-service regional areas, because we just simply don't have access to the sorts of specialists and hospitals that people in the city do.
Well, we contacted Health Minister Ryan Park's office this morning, and they said the Minister was not available to speak to us this morning, but to speak to the Ambulance Service Direct to discuss their rostering, which we are doing. And if we get onto them, we'll bring that later. And you said you have spoken to the Minister about this?
Well, I mean, we've raised on the floor of Parliament, lots and lots of issues to do with our health service across the board. And I think, so another piece of the puzzle, which people will just roll their eyes if they've heard me talking about it for 10 years, is the patient transfer system, transport system, which means if we have more of that, there's less. Basically, that's a triage of people because sometimes the AMBOs, our paramedics, are tied up. They're qualified experts to be saving lives, and then they'll be transferring someone for something fairly routine to John Flynn, for example, which can take hours with ramp time. So I think it's important if you can talk to the Health Services Union and actually talk to the paramedics about what their experience is, because I've been on inquiries where Ambulance New South Wales will say, says everything's great, but I work with the paramedics on the ground and it isn't great. And the other thing about the rosters is that what happens is our incredible paramedics then do double shifts, and our nurses do that as well. And that's unacceptable. If you've just come off a 10-hour shift, you should not be expected to keep going, and that's what's happening. So the burnout, the sick leave, and, it's the vicious cycle. So we just want to see more for regional health districts and support for our paramedics.
Now, have you, has this actually happened before? Has this situation happened before?
Look, absolutely. I've had people whistleblowing to me for a decade, and I've usually not wanted to talk about it because it scares, it's scary. It's scary for our citizens. It's scary to think that if they're having a heart attack, God forbid, but they're having a heart attack, and the only ambulances in the area are sitting waiting at a hospital, that's unacceptable.
Dreadful. So is there any way forward with this? I mean, you said you brought it up. How can what's that way forward?
Well, the Health Services Union are running a massive campaign at the moment about addressing the staffing system and improving rosters. So, the best thing people could do is get behind that, or simply reach out to the Minister and just say, I'm not the only regional MP. I can tell you regional MPs stand up every day to say that our people are not getting the health that people in the city are, and some of that is always going to be the case, but these things can be fixed, and it's just not fair on the workforce. It's not fair on the paramedics. It's not fair on those doctors and nurses in our EDs, and the Minister just needs to do better and faster.
Thank you so much, Tamara Smith, for your time this morning.